Hello, Mrs. James. How are you doing today? Wonderful. It's great to hear. My name is Fernando. I'm going to be your nurse today. Can you confirm your name and date of birth for me? LeBronna James, December 30th, 1984. Wonderful. And are you allergic to chlorhexidine, or do you have any tape allergies I should know of? You don't? Wonderful. So, we're going to be inserting a Foley catheter in you today. Have you ever had that done before? You have. Okay, well, I'm going to explain the procedure to you anyways. So the reason why we're putting a Foley catheter in is because your bladder is retaining urine, and the urinary catheter is going inside the bladder in order to help get rid of that urine easier, okay? So I'm going to start off by cleaning the labia, then I'm going to proceed by inserting the catheter into the urethra. It's going to enter the bladder. Once it's in the bladder, I'm going to inflate a small balloon that's at the tip of the catheter with saline. This is going to help the catheter stay in place. And the procedure shouldn't be painful. Might feel a little uncomfortable, might feel a little awkward, but if you feel any pain during the procedure, please let me know, okay? And then after that, I'm going to collect a urine sample, send it to the lab, have them check for any infection or anything else that they're looking for. And I'm also going to be attaching the tubing to your upper thigh to what's called the stat log. This is to make sure that it doesn't get stuck or obstructed on anything. And there will also be a urine collection bag right next to your bed that will be collecting the urine. Do you have any questions or concerns for me at this time? No? All right. And are you in any pain or discomfort right now? No? All right, let's get started. I'm just going to get my supplies together, my desk clean. We'll get started. So I'm going to close the curtains for privacy. Going to do 20 seconds of hand hygiene. All right, so 20 seconds. Pair of gloves. I'm going to wipe the desk down for 30 seconds and let it dry for 2 minutes. Dispose of that. Do 20 seconds of hand hygiene. All right, Mrs. James, we're going to continue with cleaning the labia, okay? So I'm going to place the patient in supine position. I'm going to lower the bed or the blanket, okay? All right. And then there's a Chuck's pad below the patient. Is it okay if I lift up your gown? Yes, okay, thank you. And then I'm going to place your legs in a frog-like position, okay? Let me know if you feel any pain. Any pain with that? No? All right. How about this leg? Any pain? No pain? Okay, wonderful. All right, just hang tight for me, okay? We do 20 seconds hand hygiene. I'm gonna put on our gloves. All right, Mrs. James, it's gonna be a little cold, okay? I apologize. One side. And down the middle. All right, then I'm gonna put this down for the meantime. Take these off. Do 20 seconds of hand hygiene. Now I'm going to gather my supplies. Alright. So the desk has been drying for 2 minutes, so it should be okay to put down my supplies. So I have my stat lock here. I have my chlorhexidine wipe. And I have my 10 milliliter syringe. And I have my Foley catheter kit, which I'm going to take out. Then I'm going to open this very carefully. I'm going to take out the sterile drape, making sure to only touch the outer border. Okay, making sure glossy side is down. fix that later. We'll do 20 seconds hand hygiene. All right, I'll go in the supplies. Take the sterile gloves out. Drop my syringe in. Stop it there. All right, so now I'm gonna take off these gloves. 20 seconds hand hygiene. I'm gonna put on the gloves. Sterile gloves. All right. I'm gonna go ahead and get all the supplies together. Put this over here. Take out the urine sample. All right, Mrs. James, I'm gonna go ahead and get the catheter process ready. All right, go ahead and lift this. All right, Mrs. James, gonna go ahead and clean the labia. Might be a little cold, okay? All right, inside. One side, middle. All right. Okay, Mrs. James, we're gonna start by putting the catheter in, okay? Just take a deep breath in, and on the count of 3, take a deep breath out, okay? Ready? 1, 2, 3, deep breath out. All right, see urine, so I'm going to advance about 1 to 2 more inches. All right. So now I'm going to inflate the balloon. How is that, Mrs. James? Pain-free? All right, I'm gonna make sure to pull back, and then to make sure the catheter is in place, which it is, I'm gonna push it back. Any pain, discomfort? No? Okay. I'm just gonna verbalize again. I pulled back on the catheter to make sure it was in place, which it was. And now we're going to get a urine sample. So now I'm gonna hold the port. Grab my chlorhexidine. Making sure to wipe for 10 to 15 seconds. Okay, gonna let it dry for 10 to 15 seconds. Okay, now it's been drying. Go ahead and take out 10 milliliters of urine. Put that there for later. Alright, now I can put this down. Now I'm gonna go ahead, take off my sterile gloves, do 20 seconds of hand hygiene. Alright. So now I'm gonna get the skin protectant pad, rip it open, prep the upper thigh, discard of that. And I'm gonna go ahead and get my stat lock, making sure to unclip it first. And we're going to clip it in first. There we go. Okay. And then I'm going to stick it onto the leg. And I'm also going to put this down. I'm going to take the collection bag over here. Then I'm going to attach the collection bag to the side of the bed, making sure it's below the bladder, and clipping any extra tubing to the bed. So I clip the extra tubing to the bed. And then I'm gonna go ahead and get this out of your hair. Okay, and I'm just gonna go ahead and straighten out your legs. Are you in any pain or discomfort, Mrs. James? No? Wonderful. Okay, just gonna go ahead, roll this back up. Alright, and then I'm gonna go ahead, take off my gloves, do 20 seconds of hand hygiene. Pair of gloves. Sample. That. And I'm going to make note of the patient's name, patient's medical record number, and the date and time of the procedure, and then I would send this to the lab. Alright. Okay, Mrs. James, I'm going to be your nurse today, so I'm going to do 20 seconds hand hygiene. Here's your call out if you need anything. Side rails up, bed in lowest position. Please ring that call bell if you need anything, okay? And are you in any pain or discomfort? No? Everything's fine? Yes? Okay. And then I would go ahead and do one last scan of the room, making sure that the tubing and the bag are good, which they are. And do you have any questions for me or concerns, Mrs. James? No? All right. And then I would go ahead and do date and time of the procedure. I would document the patient's tolerance of the procedure. I would document the size of the catheter used, which was a 16 Frank. I would document that the urine was yellow, clear, and had no sediment, and that the volume of the urine was 350 milliliters. All right, Mrs. James. I'm going to go ahead and clean my area and dispose of everything in the right receptacle. And then I'll see you later, Mrs. James. Thank you.